Hi, this is Dr. Gregory Doerr for Functional Soft Tissue. And today's condition of the month, we're going to show the FAKTR treatment for Achilles tendinopathy. Now in this situation, since it's a tendinopathy, we're going to be using the pro-inflammatory application, which means we're going to be a little bit more aggressive on that tendon. And since it's also a tendinopathy, we're going to be bringing in eccentric loading because we know that with increased pressure with the soft tissue treatment, we're going to increase fibroblastic proliferation. And with eccentric loading, we're going to increase collagen synthesis. So we're going to try and get the biggest bang for the buck that we can associated with our soft tissue treatment, and also implement a rehab exercise at the same time using the third concept of FAKTR, which is resistance. So what we'll first do is use a little FAKTR emollient, make sure we have enough lubrication on the skin so that the instrument glides well over it. We just want to make sure the calf is exposed. And now what we're going to have our patient do is, in some literature you'll notice that they talk about only the eccentric load for tendinopathy. Tim Tyler has obviously done some great literature associated with epicondylopathies, medial and lateral epicondylopathies, and there's other studies on Achilles tendinopathy that have shown the benefit of eccentric loading. I don't shy away from the concentric loading, but I definitely focus more on the eccentric. So when she goes up onto her toe raise in an account of maybe 1, 2, it's just to make sure that she goes down in a 1, 2, 3, 4. So we're going to have our patient go up, and now she can slowly drop down. Now initially I'm working through the entire calf just to help, this is more of a neurologic application to reset the tone of the tissue. And then what we're going to do is come down into the Achilles, and again a little bit more of an aggressive treatment. Now I'm using the smaller edge of the FAKTR 3 instrument, and we're going to be pro-inflammatory on the tendon. And if you'll notice, while I'm doing this, I'm making sure to treat the lateral aspect. I want to make sure I come in and treat the medial aspect of that tendon as well. And then I'm also going to take some time and go over the tendon, but I want to make sure I'm not quite as aggressive here because I don't want to create a tendon sheath injury and inflammation. And I also want to make sure while she's doing her motion is to come down on the attachment of the Achilles onto the calcaneus. And just relax. So just to recap, what we're doing again is through the calf muscle is doing a neurologic application to help reset the tone of the tissue. In the tendon, we're doing our pro-inflammatory application or our structural application, and we're going to be using FAKTR concept 3 to eccentrically load. Now while I've demonstrated treating the calf and the Achilles tendon, it's also important to make sure we look at the antagonist muscles here and treat the anterior compartment. So as I like to say with my patients, we help balance the seesaw and make sure everything's in proper alignment. So that, for our condition of the month, is our soft tissue FAKTR treatment associated with Achilles tendinopathy.